let's look at the ulnohumeral joint first. Okay, now depending on how much range of motion they have will determine how we're going to actually test their passive mobility. Okay, if they have a very minimal amount of range of motion, right? So if I'm looking to flex the elbow here at the ulnohumeral joint and they don't even get to 90 degrees, I'm really only going to do a rocking motion to test it, right? If they're more in this mid-range here where they're at least able to get above 90 degrees, I'm going to do a rock plus a glide. And if they're lacking just kind of the end of range of motion here, the last handful of degrees, 5 to maybe 10 degrees, we're going to do more of a hinging motion. Okay, let's show you what each of those look like. So here in the early range, now here's my grip, right? My index finger is going to be around the back side of the olecranon, right, with a little trigger grip right like that. I'm going to let the ulna rest along my arm. So if we're here, I'm going to fixate the humerus, which we may even do like this, and we're just going to rock. Everybody see that up on the screen? Okay, so that...
You're pulling your left rock and on your so that index finger.
Yes. Yep. So I'm rocking this way. Okay. So that's for an early range test. Realistically, you're only going to see somebody like this either after a surgery or after a major trauma. Okay, so you can file that away for the one time in the next year that you run into somebody that's like that. More in these middle ranges here, we're going to produce that same rock, but then we're also going to produce a glide, right? The olecranon in this plane is concave, so the glide is going to go with the motion, right? So it's going to be an anterior glide with flexion. So if you all can still see that, we're going to rock and glide. And if you can see, I'm actually using my right hand to press down as well, still creating a relative anterior glide of the humerus. Okay, I would probably use that up to about maybe 120 degrees, 130 degrees of elbow flexion. Okay, once I get beyond that, I'm going to fixate the humerus here, come on to the back side, posterior side of the ulna, and I'm going to test the glide here with the hinging movement. Right? Fingers can get in between if you need them to help with the hinging. So they would be on the inside there. And it would be that sort of test. Here's the bonus. Those are our mobilizations as well. So passive mobility testing and mobilization all in one. If we're going into extension, early extension loss would be just the rock, but again, that's going to be way up here. Very, very, very unlikely, because even with a severe trauma, you're not going to lose that much. Right? So we're realistically looking more at a rock and glide. Posterior glide this time. Okay, and then at the end of range, more in this position, we're going to fixate the humerus and we're going to create a hinging movement, right like so. Is that good? Can you all see it at least well enough? I saw one shaking head. What were you missing? You want me to show it again?
Yes.
Which one did you miss?
The last one.